Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Nibo bofirirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mu kulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana dinedo kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card. Mudikola.
Nti naba akole ne ya.
Nedo debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ikop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubedah. Candle night ogimanyi. Bagita candle night gwokutte gwobba.
Bawa wa sugar teyamazanye ku live.
Vamo jechiri. Vamo.
Bendera ddala.
Omusajja ate nga anakuswaza ajja kwana black sugar.
Abasajja munyiganga tebabati.
Noyingira n'atakubuuza. Ekibonyaabonya ababoda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Agala mutabani wange wakati w'emyaka alina okubanga ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kye nayagala ku ttiimu ya Mama Fiina.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azari right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
The pain, but they will not stop the endometriosis. Okay? So that's why we give you those other hormonal pills. There are pills that we can give you. There are even injections, hormonal injections that we can give you. All right? But if we think that the endometriosis is advanced or why it is deep and your symptoms are too severe.
Like which symptoms?
For example, you're not conceiving.
Oh, yes.
Or you are having, every time you are in hospital because of the periods and all every month. You are even scared to get the periods. Okay? Or what to cause a scanning, waliwo obuzimba in the ovaries because of endometriosis mu ovaries. Get it? Yeah. So oyine endometriosis mu rectum mu byenda. Oyine endometriosis mu kawago. The best alternative would be to remove those parts that have endometriosis. That's where now surgery comes into place.
So doctors themselves were zigenda mu bladder. Bladder si ke kawagoko.
Yes.
Urine waita. Urine tasobola kujjawo cells.
No.
Because
that's a good question. So when you look at the kawago, eringanga just like a sack. Okay? Yes, it's a sack usually.
It is not a tube.
No. The bladder is like a sack. So that sack.
That's where the urine is.
That's where the urine is stored. Look at urine vira mu kidneys. The kidneys is one that produces the urine.
Okay.
Then there are tubes that connect the kidneys to the kawago, to the bladder. So when the urine is formed from the kidneys, that urine is filtered. Nezita mu tubes jetwita ureters pakanga urine etuse mu bladder. So now the bladder stores the urine. So that when it reaches a certain level, so the bladder just stores the urine. So that sac.
So it cannot push away the cells.
It cannot because those cells are attached
on the walls of the
bladder. And those cells every month period, those cells are going to bleed. They're going to bleed. They're going to bleed. So
they just bleed. They do not go away.
They don't go away because they have attached there. And even wherever these cells are in the body, they just bleed. They don't go away. So that's why we say surgery helps to remove them from where they are attached. So what we're gonna call a surgery, we want to identify into kaliwa.
Okay,
ovaries. Can we remove it from the ovaries? Kalimu waguru wa uterus on top. Can we remove it?
Subira buli omu ali bulungi kamera nkira.
Akulindemu omuntu bw'aba akola mulinde.
Wadde ogamba ki wamma? Okay, kansubire muli bulungi bagiyita health chat ne Dr. Eladu. Dr. nno namulabye atrendinga ku TikTok. So Dr. abantu bakwagala.
Thank you.
Obeera kuli ng'olina comments mpitirivu nange nkufollowinga.
Thank you.
So I saw someone saying yagenda okulaba ne bamugaana Naggulu. Do you work in Naggulu?
I do not work in Naggulu. So I remember responding to that person's comment that
I went to see you, but they didn't give me an appointment.
So that the person actually went ahead and sent me a message. So I connected them to someone, a friend of mine who works in Naggulu.
Who works in Naggulu? Yeah. You have the same names?
No. We don't have the same names. I do not know who she saw there, but it was not me.
So tuli ku Executive Media subscribing, liking, abomalo sharing. Tukolera wano ku TMR Hospital. Guno omwezi ogwa March, TMR ina free checkups. Eri abakyala. Jangu bakebere okuli pressure, diabetes, omanye blood group yo, ne dental issues. So tosubwa omukisa ogwo gw'okujja ate babeere nga bakolako. Ndi wano ne Dr. era olwayo tugenda kwogera ku painful periods. So tuula omuwala agenze mu periods, omukyala eyazaala nga okyali mu periods naye nga zikyakuluma, naawe alina omwana naye nga tannazigendamu, n'abaami. So last time people were very happy that men are going to start family planning.
I saw the comment section.
People were very happy. Hi, Doc. Hello. How are you? Women love you so much. I have a lot of your clients. Doctor, bamwagala nnyo nti atukyusa shape n'atuwa. So, Doctor, painful periods zisinga mu bawala abatannazaala n'abazadde. Nga sinnazaala bangamba painful periods bw'ozaala tezidda. So tulina cases nyingi eza painful periods. Painful periods ziva ku ki? oluzungu dokita
Mm.
oluzungu
Tukende-
nkwegayiridde
tukende.
nina eyayombye nagaso temumanyi nti noffe tetumanyi luzungu
kati nange bali njagala tukole effective communication and waliwo ebintu sobola kunyola
byogera mu Luganda. Dokita tamanyi nno Luganda. You have broken Luganda.
I have broken Luganda,
yes.
but I
But
speak
you try
8
Gambi.
languages.
Hey. Eh.
So I am also, Luganda is getting added to the list of the languages that I actually speak. It's broken,
but
but
still Luganda, yes. So Dr. Wanaba atadde mu Luganda, please bear.
Yeah. So first is that for women, there are things that differentiate them with men. Okay, and apart from the reproductive system, joina, which shows into oli mukyala, the other sign is menstruation.
Menstruation,
of course.
yes.
And on top of the other things like childbirth and all that. When a girl is born, awera nga the system of reproduction esirise oba it is asleep. So that child goes through the early emyaka, early years, ngali mwana, goes through until about 9 to 10 years when system equality ezukuka. So the system wakes up.
Wezukira Dr. Chava abana bambagenda mu 9 obezo ziba hormones.
So now that's the time when the reproductive system starts activation
at 9 years.
About 9 years
to 10.
So the activation usually follows with formation of things that we call secondary sex characteristics. Okay, for example, the breast begin developing. What stages that breast development?
Yes.
And most people, the breast begin developing before the period starts. Okay, the breast develop. Then of course maybe the shape also. Then the voice becomes a bit high pitched. Singer yabasajja or the boys who the voice becomes deeper. Now that usually is it reaches a point in ne period zitandika, what we call menarche or onset of periods. The periods zitandise. Average age of periods starting is about 12 to 13 years. Okay, most people. Naye, if a child has got a larger weight, especially above 45 kilograms, kisoboka kutandika periods earlier.
Oh, it's about weight.
So there is a threshold in the brain that can determine nti kati ono atuuse akaseera ng'asobola kukola kyasobola kuzaala. Then so that is usually weight regulated. That's why tiny people sometimes take longer to start periods, but people who are a bit heavy and above 45 kilograms, we've seen them starting their periods at 10 years, okay, at 9, even some 9, 10, 11, okay, but average is about 12. Now, in the system of women, waliwo parts. Era leero Zubedah ngenda kusomesa. Kubanga nange njagala ofuuke musawo.
Ngenda kufuuka dokita.
Ogenda osomesa abalala. So, mu system y'abakyala waliwo parts. Okay? Waliwo ovaries.
Yes.
Zino zikuuma amagi. Okay? Waliwo tubes gye tuyita fallopian tube.
Ovaries sige magi, eh?
Sige magi kubanga ago ga actinga nga store.
Amagi gaba munda
mu ovaries.
Yeah.
Because ka ovary kabera nga store just stores the eggs. Okay? So the ovary keeps producing one egg at intervals. If this month, you're right, it was amagi. Next time, ebera ku left bencho. If you produce them at the same time, okolacho ofuna abalongo. You get it? So that those are called paternal twins. They are different eggs, so that sometimes they tend to become different sexes. Mwala ne mulenzi. So most times
tebafanagana.
Yes, tebafanagana. Okay, but if it's from the same ovary, those are the ones who look the same sex and all that. Because it's one sperm, one egg. Then wanotwina nabana. Uterus. Nabana is where the baby grows from. Okay, so if every month the ovary has given us an egg. Eno system ya nabaana etegeka to receive a baby.
Okay.
Okay? That preparation involves okubeera nga there is blood that is stored munda waki wa nabaana. Awotegedde. Now, if there is no fertilization of that egg, ekitegeeza nti this blood that was stored is not necessary. Because the blood is stored in preparation of the baby coming to attach that side nafuna omere nafuna omuka oxygen. So the blood has nutrients and oxygen. So if there is no baby that is formed, that blood of that time is not required. So omuntu oyo agenda mu period. Then the system repeats itself. That is what we call the menstrual cycle.
So mu periods the fallopian tube taina wekolera.
So the fallopian tube does not, the only part of the womb that is bleeding ebeera nabaana. And the whatever is bleeding is supposed to come out. So that so that the system prepares afresh for another egg to be fertilized. Okay? Kakati, the bleeding can actually pass mumagwa nabaana gye tuyita cervix. It can pass there nekifulumira wabweru. Sometimes the bleeding can pass in the tubes and it flows backwards. All right? So as long as there's an opening, the blood will pass there. In women, kubanga as this blood is washed away, the nabaana contracts gye tuyita ebisa or cramps. Okay? The cramping of the nabaana kiyamba okukendeza bleeding.
Cramps is in normal.
So those cramps are to help stop the bleeding, because every time nabaana crampinga ekitegeeza nti enyiga emisuwa kibeera munda mu nabaana. So when it presses the blood vessels, the bleeding also reduces. But also the cramping helps to push away the blood that is not supposed to be there. So is it normal for someone to cramp? Yes.
It is normal.
Okay? The cramping is normal. Yeah, I'm coming there. So people, wano mu nabaana waliwo ebintu gye tuyita pain receptors. If the cramping is sometimes too much, omuntu oyo awulira nga alina pain. Now, you and I know that pain ebeera relative. What you say eri pain, I may say differently. What I think is pain may not be the same pain for you. So people have different ways of perceiving pain.
Yes, waliwo abalumwa muno, waliwo olubuto nga lukuluma nnyo.
But what we are saying is that this pain can first happen naturally, nga teri kintu kyonna that is causing that pain. Okay? And usually, that is the pain that changes during the course of someone's reproductive life. Into oba afunye olubuto, if they give birth, you may find that the pain reduces or even disappears. So there are people who just have painful periods naye nga tewali kintu kyonna that is causing that.
Okay? Just afuna bufunyi pain.
And it's because of the different pain perception that that person has. And we know that over the time of their age, kasitanga akyakula, that changes. And sometimes the pain disappears. If they give birth, the pain disappears. If they grow old, the pain disappears. There are people who even start with no pain and then maybe the pain comes later on. Okay? What matters is nti teri kintu kyonna kikozinga that pain. Now there's a category of people who have other things that are causing pain. Okay?
Mu uterus.
So, for example, waliwo abantu babeera n'ebizimba nabaana. Okay? So it means that woba nabaana a crampinga, that nabaana presses on ebizimba, and that contraction ku kizimba is going to trigger more pain. So that person agenda alumizibwa nnyo okusinga omuntu waki wabuliro, or even before it find the pain is worse than how it used to be. So one of the cause of painful periods could be ebizimba. Okay? The second one could be jetwita, and usually that's the commonest one, ebizimba, in women. The second one is what
commonest one buli aina too much pain.
Yes, the commonest
Ali
cause
likely okuba
could be ebizimba. The second commonest cause is what we call endometriosis. Kakati
Endometriosis.
mpola endometriosis.
Metriosis.
So you pronounce it as one word?
Endometriosis. Yes.
So endometriosis means ekitegeeza nti kubanga nakugambye dda nti the cells that are bled zikulira wano mu nabaana, they grow in the uterus. Okay?
Yes.
Those cells are not supposed to be in any other part of the body okujjako munda waki wanabaana. Now in some people these cells can migrate from wano, then they pass on the fallopian tubes and they go out of the nabana and they grow in other parts of the pelvis. Kanchidemu? Nti, these cells are only supposed to be wano wakati wachi wanabana. The ones that are washed away. If they leave this place and they grow in other places, for example, kankulage kano. So you may find that these cells live here, nebikulira wano mu ovary, oba nebukulira on top of the tube, oba on top of the uterus. Some even go nebikulira ku byenda mu rectum. Others even go and grow on the bladder kawagu. As long as those cells leave this place or migrate and they grow out of the womb, that is called endometriosis. The endometriosis means that the cells have left
the
uterus and they have grown in other places of the uterus. So it means that when this person is going through the menstrual cycle, jukira nti waliwo preparation ebeera wano munda to prepare to receive the baby, and those cells store blood. So wherever those other cells are located, if they are wano on the surface of the tube, nazo zikola ki, they also get prepared. Ezafulumye. So wherever they are located, they also respond to those hormones of the menstrual cycle and they start storing blood. So if it's the ovary, they will start storing blood there. If it's on top of the navana, it stores blood. If it is in the rectum, it stores blood. And when this person is going to bleed period, nazo zikola ki, zibleedinga. So that is usually because if the cells are out of the womb and they're bleeding in the uterus, that bleeding in the uterus triggers too much pain.
Okusinga wali eringa zikirira mu uterus. So the single letter pain.
So you find this person who has endometriosis will feel too much pain even before the period starts. Then the pain is too much during the periods. Then the pain is even can persist after the periods. Kubanga waloka bleeding that has happened out of the uterus. Okay? Now, initially we notice this pain starts nga ali kumpi ku period or during the periods. And this pain can be too much that tasobola kola kintu kyonna. Nga every time agenda mu period they have to give a kitanda oba empeke dagala tasobola agenda ku mulimu, cannot do anything. That's why we are saying nti oba oliawo and you're feeling too much pain that is affecting your day-to-day life, genda ku ddwaliro oba jangu ku ddwaliro tukebere tubeere sure nti toyina endometriosis.
Kati endometriosis bamukebera batya?
I'm coming to that point. All right? So, tugambye, endometriosis means that zino cells zifulumye era ziri out of the uterus and they are bleeding during the time of periods.
Yes.
And we said the sign into you could be having endometriosis is too much pain or period.
Yes.
Sometimes if the endometriosis has taken some time, that person ends up feeling pain. Buli kaseera si ku period yokka. Nti even out of the period they are feeling too much pain mu lubuto. This endometriosis, because every time there is bleeding, there is a response to that bleeding mu system mu lubuto. And that time that response can cause the other organs to stick together. Okay? So you find that the ovary can get stuck. You can see these things. They are
Yes.
showing that the ovary can get stuck to the uterus. The vienda can get stuck to the uterus or wherever the endometriosis is. Okay? The other sign that this person has endometriosis is ngafuna constipation when they're in their periods. It means that maybe the endometriosis has gone to the vienda, to the rectum. So buli kaseera ng'ogenda mu period ofuna constipation. Oba you pass stool nga waliwo omusayisaayi. Or if it is in the kawago, in the bladder, that person afuluma ogundi omusaayi ngafuka, especially during periods.
Dokita okufuluma bw'oba ofuka n'ofuluma omusaayi si kirungi nga tandi mu periods.
Si kirungi. Which means that either there is endometriosis mu kawago, so we need to be sure and toyina endometriosis mu kawago. Then we have seen that people who are failing to get pregnant,
yes,
over 30 to 40% of those people are because of endometriosis. So what does endometriosis do? It will affect amajigo. They are not functioning well. You cannot produce a good egg. It can make these structures to be stuck. Even if you ovulate, the tube it cannot pull the egg into the what? Into the fallopian tube. So it means that that person will struggle with issues of conceiving. Okay, so those are the signs, the spectrum of endometriosis. Much is endometriosis awareness. That's why we're bringing this show. If you are there, don't keep quiet on pain. In our community, bagamba or guma or mukazi aguma,
periods buli omuzi muluma.
But we are saying, please, painful periods is not a sign of strength. It could be a sign in Titwina, we have a problem and we need to find out what it is. Okay? Now, to answer your question, how do we tell into omuntu aina endometriosis? One, symptoms. Yetugambe. Pain. Okay? We also take history mu family. Oyinza ofuna nti mama yafunako endometriosis, especially if it is your mother or your sisters. If there is that history in family, that means, and you're feeling too much pain, you could be having endometriosis. Number two, scan.
This normal scan?
See, normal. There is a different scan, Jetuita transvaginal endometriosis scan. Once.
Doctor, scan yetiisa.
It's not okay. It's not comfortable.
Yeah, it's
but
not comfortable.
It should not really be painful. But that scan helps us. Kubanga nabana ewera kumpi ne vagina if you're not pregnant. So when you pass the probe down, you can easily see these things better. And it has to be done by someone who has undergone training, because training for endometriosis, it's easy to miss it mu scan oba muntu tamanyi what they're looking for.
Ne batazira cells weziri. Okay.
So the person doing that scan should really know how to do what they call an endometriosis scan. Okay? But also scans can miss. The third test, that is not very common, je bayita MRI. Simanyi ba wawulirako MRI. Umanyi CT scan ne waliwo ne MRI. Okay?
MRI ye bakuteekamu.
Eyo CT. But also when the MRI is like that.
Oh.
So there's MRI that can be done, but the definitive confirmation into endometriosis, ye laparoscopy.
Yeriwa laparoscopy.
Nakugambye luli nti laparoscopy ye okukozesa kamera kulengera munda muki mu lubuto. Ojjukira that operation.
Yes.
Because you can only confirm endometriosis when you have seen ebintu ebyo out of the So laparoscopy helps us to take our camera to start a very small incision, to take a camera, to kebera. Wano kukawago, wano kunvienda, wansi ya waliwo other cells.
Just check up.
Just check up.
Nemonsala.
Ati tetusala. Just tukola small katuli, to take our camera.
So munzikiza.
Yes.
Yeah. Doctor.
But even before we go there, the scans that are done are much, much better. So what I call a scan bulungi, and they will tell you into wano or in endometriosis, and it is in 1, 2, 3, 4 places. So that when you now intervention of endometriosis is to remove those cells. To if they're here, we have to remove it.
You have to go for an operation.
Yes. So in terms of treatment, I thought we were going to go there. Because the most important thing is confirming
that you have them.
You have endometriosis.
Yes.
Okay? When we suspect or confirm, then we say, okay, what do we do next?
Operation.
See, operation. In terms of management of endometriosis, there are different options. One to gambit, depending on the extent of the disease. There are those ones who are there, they are getting pregnant.
Yes.
Even with endometriosis. And they're not having too much pain, much as they have endometriosis. So those ones, you may not have to go for surgery. You may just deal with the pain.
You deal with the pain?
You give them medication to manage the pain.
Tabs.
Okay. Okay? Could be tabs for pain, could be injections for pain. But if you realize that those ones are not working, and I will tell you this, that endometriosis is one of the diseases that are not easily diagnosed in time. What do I mean? The average time of confirming endometriosis is about 4 to 12 years.
Why?
Because people don't suspect it.
Oh, because they think it's normal.
The waliwo stigma ya painful periods. If you start crying into periods, they start saying oli weak. So you find that tulwayo nnyo okutegeera nti omuntu alina endometriosis. And that means that the longer the disease stays there, the more complications omuntu agenda afuna. Okay? So we are telling people out there in this month,
yes,
don't take time. Because the earlier we find out, the better the treatment. If the endometriosis is not yet advanced, or what we treat deep endometriosis, we can manage you with medications. We can give you medicines to deal with the pain, all right? We can give calendar, hormones, the hormonal pills, family planning, that we can give you to control the pain.
Monthly?
Yes, monthly.
Painkillers, doctor.
No, but you see,
like the way you be taking painkillers.
Because endometriosis is caused by hormones. So if you take the hormones, you are able to control the pain that comes with hormones.
So we do it wrong, in the wrong way.
Yes.
Taking antibiotics and the painkillers, those strong painkillers.
The painkillers will help control the pain, but they will not stop the endometriosis. Okay? So that's why we give you those other hormonal pills. There are pills that we can give you. There are even injections, hormonal injections that we can give you. All right? But if we think that the endometriosis is advanced or why it is deep and your symptoms are too severe.
Like which symptoms?
For example, you are not conceiving.
Oh, yes.
Or you are having, every time you are in hospital because of the periods and all every month. You are even scared to get the periods. Okay? Or what to cause a scanning, obuzimba in the ovaries because of endometriosis ovaries. Get it? Yeah. So, or in endometriosis mu rectum, mu byenda, or in endometriosis mu kawago. The best alternative would be to remove those parts that have endometriosis. That's where now surgery comes into place.
So doctors, zigenda mu bladder. Bladder si ke kawagoko.
Yes.
Urine waita. Urine tasobola kujjawo cells.
No.
Because
that's a good question. So when you look at the kawago, eringanga just like a sack. Okay? Yes, it's a sack usually.
It is not a tube.
No. The bladder is like a sack. So that's
where the urine is.
That's where the urine is stored. Look at urine vira mu kidneys. The kidneys is one that produces the urine.
Okay.
Then there are tubes that connect the kidneys to the kawago, to the bladder. So when the urine is formed from the kidneys, that urine is filtered. Neziyita mu tubes je tuyita ureters paka nga urine etuuse mu bladder.
Eryoka efuluma.
So now the bladder stores the urine. So that when it reaches a certain level, so the bladder just stores the urine. So that sac,
So it cannot push away the cells.
it cannot,
when I'm urinating.
because those cells are attached
on the walls of the
bladder. And those cells every month, period, those cells are going to bleed. They're going to bleed. They're going to bleed. So
they just bleed. They do not go away.
They don't go away because they have attached there. And even wherever these cells are in the body, they just bleed. They don't go away. So that's why we say surgery helps to remove them from where they are attached. So what we're going to call surgery, we want to identify into kaliwa.
Okay,
ovaries. Can we remove it from the ovaries? Kalimu wagulu wa uterus on top. Can we remove it? Kalimu bienda. Can we remove that patch so that olemo funa constipation ngogena furuma?
Okay.
So that's where the surgery really comes in.
Okay. So doctor, after the surgery, you've removed the cells. Tezikomao?
That's a good question. So surgery does not entirely prevent the endometriosis from recurring, but surgery helps to relieve the symptoms. And I know what, because I want to give the clear information out there.
Yes.
By the time doctor again about endometriosis, they're going to explain these things to you. What the endometriosis surgery aims to relieve symptoms. And most times when we remove those areas where the endometriosis is, omuntu awulira bulungi ne pain ekendera.
But after some time?
It depends. Oba okyagenda mu period. Kubanga this endometriosis affects women from the time they start. It can affect them from the time they start periods paka menopause, because the issue of endometriosis are the hormones. But we can give you, I can assure you that many times when we do the surgery, the person lives pain-free.
Okay.
Okay? So that's the benefit of the surgery. They are pain-free. And then we keep monitoring them.
Okulaba
or not. And
so you keep on doing scans.
Yeah, monitor also the symptoms. Most women actually live pain-free until they reach menopause and it doesn't come back. You get it, eh?
So it depends.
It depends. You're going for surgery. The doctors will explain to you, because it's very important. Now, that the surgery is to relieve the symptoms that you're having. Currently, we don't have like a cure. And now if you go and read about endometriosis, they'll tell you there is no known cure. But the options jetwina is to relieve symptoms. Reduce pain, reduce bleeding, because some people who have endometriosis even have heavy bleeding. Reduce bleeding, improve fertility, and improve the quality of life of this person.
Okay. Painful periods. So if I don't have painful periods, doctor, but I bleed for a full week and it is heavy blood, mbera nina endometriosis.
Zubedah, today you're asking very good questions.
Yes. Die. So that is a credit. I'm going to be a gyno.
I mean, Kakati, much as pain is the commonest sign of endometriosis.
Yes.
Waliwo abakyala abalina endometriosis nga naye nga tebalina pain. You may find the only sign into that helps us to find out endometriosis is infertility. Nti tosobola kufuna mwana. Kitegedde. Naye nga bwe batubuuza tukubuuza ebya period ogamba musawo sirina nfuna period zange bulungi ennaku 3 naye nga sirina pain. So again, pain is the commonest sign nti oyina endometriosis, but it's not the only sign. Waliwo abakyala nga tebalina pain, but they could also have endometriosis, especially if it's infertility or heavy bleeding. Well, heavy bleeding is another sign of endometriosis. Okay, so again, don't fix your mind and you think that it's only pain. No, sometimes endometriosis can be present even without pain, but commonly
with pain.
Pain is the commonest symptom of endometriosis.
So omukyala akozesa paadi 3 olunaku nga zonna zijjudde. Ali likely okuba nga alina endometriosis.
So not really, but now it takes us to what is a normal menstrual period.
Yes.
Okay, so first and foremost, the normal menstrual period should not last longer than 7 days. So it's usually between 2 to 7 days, right? Rarely is it 1 day, okay? But it's about 2 to 7 days. Number 2, the bleeding should be normal. See, heavy, normal bleeding, they say you lose about 80 mils of blood. But that means that on average, achusa pads about 3 to 4 times in a day. Okay? When you start going to 5 times, and we are saying you're changing because a jude, not because totally comfortable.
Oh.
You get it? Because you may be there and you're just
Okay.
not comfortable.
Let me change.
But there are people who actually the pad gets full that they need to get another one.
Yes.
And if they do that 5 times, 6 times, all right? So that is a problem. That is not normal. And it has to be found out. But 3 times, 4 times, it's actually normal. All right. Number 3, we are saying that periods can present with no pain. Periods can present with some pain, but the pain should not be debilitating. It should not affect your day-to-day activity.
Debilitating. Dr. Kapia.
Tugambe tugenda koza Oluganda tusigale mu tukozese Oluganda. So the pain should not make you feel like you're not yourself. Right? So you can have cramps, but the cramps should be bearable. Okay? That even when you take a slight painkiller, everything is okay. All right? You are able to go to work, you're able to do your housework, you're able to take care of your family and all that. The pain should not make you bedridden. Period, you are at home, you cannot stand up, you cannot walk because the pain is too much. All right? So those are the common characteristics of the period. Now, it keeps on changing during the course of your life. Okay? There are people who start, they bleed 3 or 4 days.
Yes.
Okay, no pain. Then after maybe some years or after childbirth, they feel some cramps. But that should be okay. All right? But then we want you to take note of the signs that the periods are not normal. For example, the pain, the heavy bleeding, the number of days. You cannot be there and go bleeding at 10 days, 2 weeks, and you think it's normal. It's normal. When you experience that, you go to hospital.
Okay.
Let the doctors assess and tell you, we have seen ABCD. Because like I told you before, it can be fibroids, could be endometriosis, could be polyps. Okay,
polyps yani ate doctor.
Kakati. So polyps.
Era naye ali mu periods.
Polyps usually cause abnormal bleeding. So you remember that layer that is supposed to be washed away.
In the uterus.
In the uterus, endometrium. Okay? So sometimes that layer can also kuzimba on that layer which is supposed to be washed away. So those
because it is not washed away.
Either because or because it was some part of that layer that starts growing and becomes longer. That is what we call polyps. Okay? Fibroids, those zivira mu muscle layer yanabana. Okay? So if you realize and the periods should happen once or monthly. Okay? The average cycle length of normal periods is about 21 to about 35 days. There are special people who get 2 periods in a month.
Yes.
So as long as enaku za cycle are within 21 days, it's okay. But if it's less than 21 days, jangu kudwaliro.
Bakebiri.
If it is longer than 35 days, that means for you, you can miss 1 month, but often a period. You come and we find out what is causing that abnormal range of the periods.
Okay. So, doctor, lwaki bwe tubeera ne stress tugenda mu periods? Is it normal?
Yes. So,
ki ekibeera affected mu uterus okubanga ngenda periods, yet it's not, they are not my days, but I was stressed ningenda mu periods. Abagole bafuna bagenda mu periods.
So there your hormone system can be affected by the environment. There are people whose periods are affected when they bali mu nnyonyi ne bagenda to another country. As soon as they arrive, the periods come. Yes. So the hormone system has got other environmental factors that can influence it. So could be change of environment or change of weather, okay? Could be stress, okay? You're going through extreme stress. So you can actually see your periods sooner, or it can take long for your periods to come. So what only the periods, but you're not seeing them 1, 2 or 3, even 1 week, but then after they come, got already pregnant, okay? They can also be affected by your weight. If you lose weight extremely, your periods can disappear.
If I lose?
Extreme weight loss.
Yes.
Yes. So there's losing weight proportionately. Now, it's like you just, from how you look now and then you become very thin, your periods can disappear. Number 4, exercise. Athletes, there are people who are jogging, preparing for marathon, that can affect the control centers of the brain and the periods disappear. So there are things that normally affect periods. And most times when you go to hospital, the doctor will ask you what is happening. Okay? Then there are certain drugs that can affect periods as well.
Okay.
So it's important that if none of those is happening and your periods are not normal, then there could be something wrong that they have to check and see.
So, doctor, do you also in science, like, do you also believe in counting days? Like when a girl is approaching periods, or that day you start the periods, they tell you to count the days, that those are the days you're supposed to spend in your periods. Do you also have it?
First explain that.
The first day you experience your periods,
yes.
In culture, they say you count the days. If they tell me to count 3 days, those are the days that I'm going to be in my periods.
Hey, yes. If you start your periods later, then you start counting.
Yeah, I start counting. The first day that I experienced my periods as a teenager, I have to count.
You count what?
The days. Like if they tell me to count 3, those are the days that I'm going to spend in my periods.
For the rest of your life?
Yes.
No.
I'm not supposed to exceed the 3 because I counted 3. If you count 4, those are the days you're supposed to spend.
I understand.
So do you have it in science?
So in science, that is not true. Because nakugambia average days of periods can be between 2 to 7.
Okay. Yes.
So it keeps on changing as you keep growing. As a nakuzichoka.
Oh.
Standard, they don't go above 7 days. All right. So you may find that for the first 10 years of your life, your periods take about 3 to 4 days, 3 to 4 days. But then maybe by the time you're approaching towards menopause and all that, the days change. Maybe they go to 4 days or 5 days, as long as they don't go beyond 7 days. So it can happen in between there. For you, what you should know is that anything 7 and below, no more.
So it doesn't. It does. Even if I count, time is going to come,
and it will change.
And it is going to change.
Yes, it's like saying into enaku zoza menstrual cycle are 28. Okay, because again, I'm sure you've seen that somewhere. That your menstrual cycle days are 28. They're not constant. That's why we give a range into they can be as low as 21 days, or they can even reach 35. As long as chiriawo wakati, it is normal. So the only thing to help patients out there is you to get your monthly period. Kastango funa period buli mwezi.
No igo bibala.
No igo bibala, that's okay.
So akantu ko kubala ennaku. Batu bazise ennaku. Akantu ko kubala ennaku doctor agambye ennaku zo sobola okukyuka. Gyoko mugenda ng'okula. Manyi kibadde kitweraliikiriza doctor. Wabala 3 ate olaba oli mu nnaku 5. Agamba ngate bakubalira 3, even parents are disturbed. Nagamba nakubalira 3 lwaki oli mu 5.
So it can change, and it is very normal because that is how the range of the reproductive system.
So is it healthy to have sex when you're in your periods?
It is. Zubedah, this is the second time you're asking.
Because we are talking about periods. Last time people did not hear your answer when. Yes.
So
is it healthy?
It is not healthy. It is not recommended.
Okay?
Why?
Because first is the comfort.
Okay.
Okay? The comfort of both partners. Number 2, body fluid exchange. By the time you are bleeding, it means if someone has got any infections like HIV or hepatitis B and all that, during that time, that is the time when there's highest chance of transmission of some of these diseases.
But the blood is not dirty. It does not have infections. That blood that is flowing is not dirty.
No, if it's not infected blood.
It is not.
It is not. But no, not necessarily. Chisinzira ku muntu.
Muntu chi.
It depends on the person. If I have infections, if I have hepatitis B, that blood can have hepatitis B.
Oh.
If I have HIV, that blood definitely would have HIV.
But again, they said when you're in periods and you're having sex, that blood can flow back to the uterus. Is it true?
It means you are either blocking
Doctor, please answer. Does it flow back?
Not necessarily, because once the uterus has opened and pushed that blood out,
it is already
out. It's going to come out. It's not going to go back inside the uterus.
I'm asking for the people. Nkole abantu. Nkole abantu. So Dr. Dennis is here. Dr. Dennis, when is our futari? Because we want to ask you when we are in camera. When is our futari? We need futari. Doctor,
Yes.
last time we said we should campaign for this. Yes. We get the futari. We should have dinner here. Like, when is Eid? Yeah? Eid? 19th or 28th. Remember, we don't have an exact date. But before those days.
Captured in camera.
Captured in camera. So, tell kwasa. So akakabuzo kabadde kabachala because twabadenga tubagamba don't do sex when you're in your periods.
True.
In our religion, it is haram. It is prohibited.
True.
So
I think also science backs it. It's really not recommended. Sexual intercourse during the periods is not a very good time.
So Doctor, waliwo omuntu afuna olubuto nasigala nga agenda mu periods ze.
Okay. So let me answer.
Agenda otegeera nti ali lubuto ng'olubuto olumu lwa myezi ng'esatu kwena.
Okay.
Nga periods ze tezikomanga kati nga wano wannyonnyodde nti omuntu bw'afuna olubuto ovaries ziba tezikyaleeta magi kukola biki kugenda mu uterus kuyiwa musaayi. But ono ali lubuto lwaki ate asigala kyagenda mu periods?
Okay. So when you get pregnant, normally the pregnancy happens 2 weeks from the start of the period.
Yes.
Okay? That is if you have a 28-day cycle. So it happens around 2 weeks from the start of the period. Now, it means that by the time the baby is going to attach more uterus, okay, that is almost 3 to 4 weeks from the time you started bleeding. Okay? So, kubanga fertilization taking a place muchi museke mu fallopian tubes. So that baby has to come down by the 5th, 7th, 8th day. I know kuja wano munabana, and then that baby must implant attach munabana.
Yekwata kunabana.
Yekwata kunabana. During that time of yekwata kunabana, sometimes there might be some bleeding. Okay?
Munabana.
That can occur
in the uterus.
In the uterus.
When the baby is attaching.
Yeah. So that bleeding is what we call implantation bleeding. Kitegeza nti omwana agezako okwekwata muki munabana. That bleeding can sometimes confuse people nti agenze mu period. Naye nga si period, but because the baby is attaching to the nabana. The difference is that this so-called period is not the same as the usual period. You may find that bleeding may happen if you usually ogenda na kutano period. You may find that this time maybe 3 days or but and it may not be very heavy bleeding. But because some people are in denial, ayinza ogamba nti noza nfuneyo period.
Yes.
Naye nga that is not a period, that is just bleeding that has come from the baby attaching in the uterus. And that bleeding can happen for a few days, not so much. So it is very rare beyond the first month of pregnancy for someone to continue having menses or menstruation. Ekitegedde? Unless that bleeding around the baby is still happening.
Oh, it is still in the uterus.
So most times if someone is pregnant naye nga bleeding, we tell them jangu tukole scan tulabe if there is bleeding around the baby, because that can be what you're mistaking into the period. Naye nga waliwo ka bleeding that is happening around the baby.
Ng'omwana ali bulungi.
Ng'ali bulungi.
Oh.
Or you may find even that sometimes the pregnancy is failing, so there is bleeding around the baby.
Oh, it's also a sign of a miscarriage.
It can be a sign of a miscarriage. So
you need to go to the hospital.
Go to hospital, bakole scan, then they see if the baby alive. Sometimes we put you on treatment. That can allow that bleeding to disappear so that the pregnancy continues.
Okay. So doctor, waliwo abakyala abagenda mu periods n'afuna a heavy bleeding naye nga ya clotting. Ne babaga abanywa amazzi agookya. Like, does hot water help you with clotting, with that clotting blood?
Yes, hot water helps to expel, even during periods when you are, warm water helps with pain control, okay? Or even a warm pack on the rubuto helps with, reducing the pain. It could be a warm or cold pack. Yeah, but the hot water is just for your body to help maybe expel the clots and all that. Take it, yeah.
So kufuna clotting or bleeding, like you're in your menstruation periods, nengo msayo gugo, gulinga ebitole like gulinga clot. Is it also normal?
So it
techiri kuchiri.
Yes, much as the bleeding can sometimes be like clear bleeding, but for some people, depending on if the blood was able to come out, because sometimes period eyinza otandika nga omumagwa n'abaana tenabagula bulungi. So you may find that the cervix hasn't yet opened that well. So you may find the blood accumulates nekiforming a clot and then it comes out. So as long as
the blood,
not see blood, omumagwa n'abaana, the cervix, the cervix, if it hasn't opened that well to allow the clear blood to come out,
it has to open when we are in menstruation.
Yes, that is how that blood comes out.
Like as if we are going in labor.
Not to that level. Kubanga eri ya labor etuuka 10 centimeters. But this one opens just a few centimeters to allow that blood and whatever is being washed out to come out. So sometimes if that doesn't happen, then you find that the clots form. But then when it opens, then the clots come out.
Okay. Yeah. So waliwo abafuna clothing n'afuna omusaayi nga gulimu white. N'abanga eyazadde like obanga eyazadde naye ng'omusaayi gulimu white but nga tewazadde. Naye nga omusaayi gye gwafulumye like menstruation ye omusaayi gwa bitole naye nga gulimu color ya white.
Now, of course, there are variations of bleeding, but it should be clear bleeding. Some clots can happen, but then again, if you notice anything abnormal, for example, bulijjo ogenda periods bulungi, ng'ofuna periods nga it's light bleeding and all that, then you start having clots, start having pain, jangu. Let us be sure that there is no other problem happening mu system yo to cause that change in that bleeding pattern.
Okay, so is it normal for someone to bleed for one day? Nkera n'ava mu periods.
So it's rare.
Because we balimba oli agamba nze bleeding 2 days ngamazi.
2 days is okay. Yeah, 2 days, but less than 2 days, 1 day, we need to be sure why are you bleeding for very short. There are some people even who don't get bleeding, bafuna just spotting.
Yes.
So that again shows that maybe that uterus did not prepare well to receive the baby. So the question is, why is the uterus not preparing well? Did the ovary produce the egg? Now you see.
The ovaries producing the magi.
So if the ovary does not produce the egg, so the uterus is not prepared to receive the egg. So you may find that you're just often spotting. And that is common with people who have polycystic ovarian syndrome, which we are going to talk about. PCOS. PCOS.
Ovary.
Polycystic ovarian syndrome. Kubanga PCOS abbreviation PCOS. So that abbreviation has a meaning. P is for poly, C is for cystic, O is for ovarian, then S is syndrome, polycystic ovarian syndrome. So people who have polycystic ovarian syndrome most times do not produce eggs. So if they don't produce eggs, the uterus does not prepare.
So gwe bayita ali barren, ye mukazi ali barren.
Si barren kubanga nabo basobola kufuna abaana. If they come to us with their treatments, we can give them that can help them get the baby. But that one is not going to have normal periods. Or yaberanga either some months are missing a periods, or some months afuna period ntono nga spots. Okay? Yes. So for people who have PCOS, they will not have a normal pattern of bleeding. That's why for me the emphasis is you should know what is normal. So that if anything is not normal, jangu, let them find out why is it not normal, so that we can be able to deal with that.
Okay, so abayina periods ziruma Dr. buli kimu akinyonnyodde bulungi nnyo ddala naye mu byonna genda mu ddwaliro obuuze dokita wo oba okole sikaani omanye kiki ekikutawaanya. So omwezi dokita agambye omwezi guno gwa baluma periods. Painful periods.
Endometriosis awareness.
Kagambo kannemye.
But you Atlantis.
Endometriosis awareness.
Yes.
Tobeereeyo awareness ya ssente like agenda mu ddwaliro lyonna.
Yeah, so
oba waliwo specific scans we ziri oba omuntu asobola ogenda mu scan wonna ebagerera scans n'agala kino.
Yeah, but the awareness gye tukola nga gynes and obstetricians and laparoscopic endometriosis doctors is that twagala abantu bamanye that this condition exists. Number two is that don't sit there nga you are feeling too much pain in the periods, because the longer you delay to confirm nofuna enjawulo oba treatment, the more complicated condition is going to become. Okay? So go visit your doctor or visit your gynecologists. Okay? And I know sometimes, of course, not so many people are informed, but I'm sure these doctors should be able to guide you. Even them, they know there are specific centers that deal with endometriosis. Okay? So they should be able to guide you to those centers that deal with endometriosis. And there are even support groups for women buying endometriosis. Yes, I think there's a support group in Uganda, there's one in Kenya and all that. These are groups that help. Because you see, endometriosis is just not doctors. Tukolanga team. So there's a team of
it is serious.
It's a serious issue. There's a team of doctors, there's a team of counselors, there's a team of pain relief specialists, okay? Because you see, these painful periods, they have caused depression in women.
Yes.
Okay? They have caused marriages to break. You get it? They have caused...
And you
get it? So you find that if we have to work as a team, physiotherapists to help with the pain, you get it, even for the recovery. So there are support groups out there that if you are suffering with endometriosis, the doctors should be able to guide you to that group, or you should be able to get that group and you join and you hear from other people who have had endometriosis what options were suggested to them and how have they dealt with that condition.
Okay, so doctor, as we wrap up, fallopian tube yange esobola okuzibikira olw'obukyafu obuyitawo mu menstruation?
No.
It cannot?
It cannot.
Doctor batunywesezza eddagala. Buli wogenda mu periods nga bagamba kati anti wavudde mu periods olina cleansing oluseke. Cleansing oluseke because omusayi gwakutte mweguli ebikyafu like kyova nakubuziza wali menstruation omusayi gwo guba mukyafu.
So the menstruation, really, the blood that comes from menstruation, because it's your body, okay, if it's within the body, that blood should not cause blockage in the fallopian tubes.
But does it pass through them?
It can pass through the fallopian tubes, okay? Into maybe the pelvic area, all right? But the commonest, if I showed you the opening of the fallopian tube, maybe after the session I'll show you. Now it's very, very small. You'll see it's like a small dot. So it's not very common into your body that they can easily go there and then they get stuck. Not really. Most likely what goes through are just liquid sort of blood and then it goes and comes out of the fallopian tube.
lwaki embuto zigendamu ne bagamba wafunye ectopic?
Because the baby that forms, when the baby is forming, elinganga sperms, you cannot see one sperm with your eye. Or you know, causes a microscope. Even the egg, you cannot see into nkalabye kako kaisawo tosobola. It is very small, microscopic. So when the baby is forming, these two microscopic sperms and egg must meet nechiforminga chi mwana. So now that is the one that starts expanding. Now, fallopian tube taina space to allow the baby to grow as compared to nabana. Okay. That's why omwana oyo alina okomawo to roll back
agende mu uterus.
Mu uterus akulirawo muki mu uterus. Now, if you have any issues mu fallopian tube, if your fallopian tubes are blocked or they are narrow, it means that baby will not come back bulungi oba getting stuck mu fallopian tube, and the baby will keep on growing. Kitegede. Kati now mu fallopian tube, bajukira fallopian tube ntono nnyo. So if the baby keeps on growing, again that's stretching a fallopian tube until your tube ekola ki?
Bulumi bwotandika owulira.
Until that tube will burst. Yetugamba ruptured ectopic pregnancy.
But again, ectopic doctor oba olaba omusayi oba tomanyi kijja.
Kituufu
kubanga you see the blood flowing nga tegukoma. Then nowulira pain ey'amaanyi. But you don't know what's happening.
The pain is happening because of the stretching of the tube, and also if the tube has already burst, that blood will cause irritation mu lubuto n'olumizibwa n'ofuna pain y'amaanyi. Number two, because the pregnancy has occurred, regardless of where the pregnancy has occurred, the uterus will always prepare for the pregnancy.
It is preparing.
You find even before you get pregnant, the uterus has prepared. Tugenda funa omugenyi, kale katutegeke. But if the baby occurs out of the uterus will still prepare. Okay? So that's why oba ogenze for your first antenatal scan, kiri very important to see mwana ngali munda munabaana. Because if it's not in the uterus elaga sign into, hey, this uterus is looking pregnant, naye tetulaba mwana. So where is the baby? Eri mu nseke, eri mu ovary, can even be in the liver. There is a lady with the liver. Nga mwana yakulira mu kibumba. The placenta attached ku kibumba.
Namuzala.
We had to operate her.
But the baby was okay.
Yeah, baby nga ina almost myezi 7-8. Teyagendako kukola scan. And that is dangerous. Okay?
Kisoboka omwana natakulya mu uterus.
Yes, kisoboka. That is what we call abdominal pregnancies. Nabo bwe bali. The difference is obolyawo ogenda kulira nga movements za mwana, they are more sensitive. Singa kali kati kabe kakulira mu uterus. And you can see nga ebigere bitambula biki. So you find that you can easily perceive the movements, they are more painful.
Olaba akagere wano.
Yabatali mu uterus. So sometimes it can be when it's not in the uterus.
Ng'enjala oziraba.
So that's why it's important for people.
But then the money doctor mwana inakola mu uterus woka.
Uterus is the only
space. That's abnormal.
The uterus is the only space that is designed to allow. Kubanga uterus before you're pregnant is like the size of your fist. Now when you get pregnant, uterus atuka paka one. So it's the only structure that can expand so many times to allow for the baby to grow there. So if that baby grows anywhere else, tesobola sustaining omwana oyo.
Okay. So lero doctor ayogedde ku bintu bingi naye njagala mubuuza kano nga tumaliriza. Producer wemala okamubuuza doctor ne bw'omuggyako. Doctor, lwaki tufuna line ya black wano ku lubuto?
Hormones.
That is not the umbilical cord.
No, umbilical cord this.
Ng'ambe y'omwana. They told us akantu la black ono lubeera ku lubuto ng'oli lubuto. The umbilical cord y'omwana yo bwe yenkana.
Nedda. That is not the umbilical cord. Kubanga mwana abeera mu nabaana, okay?
Yes, so, but this is a sign of how it.
So that's a sign of just pregnancy. When you see that middle line becoming darker, there are hormones that are responsible to cause the darkening of that middle line of the stomach. Now, that is not the umbilical cord y'omwana, and doesn't even signify the length of umbilical cord y'omwana. It's just an effect. It's like nga bafuna pregnancy nose. Enyindo ezimba.
Kati waliwo abatakafuna.
Which one? One? No, almost
everyone.
Everyone gets here. Because of pregnancy hormones.
So it's not the umbilical cord.
It's not the umbilical cord, your man.
Heaven. Misinformation. So katuberekereze Dr. Osiiba. Leero wasiibi.
Totwala basina kofia.
Dokita tagenda kuba kufutaali.
Nedda Zubedah tondeka.
Tosiibye ennaku ziwera. Siibayo zino ezisigaddeyo.
Yes.
So Dokita kwali ku TikTok abeerako.
Yes.
Oli ku pregnancy series. Yes.
And for pregnant mothers out there, that is good information.
Yes.
That you can actually learn on what's happening. So
So please go and follow Dr. Eladu. Gwali olubuto na wasuubira okufuna olubuto. Enamba ze kweziri. N'amalwaliro ndowooza w'okolera Dokita. Abantu baba babeereyo bakubuuza. Doctor, you're also on Instagram? You're on YouTube?
I'm on YouTube, yes.
Yeah, Doctor is on YouTube.
And TikTok.
Yes. So go and follow him, Dr. Eladu. Yes. TikTok, YouTube. Yeah, YouTube no Dr. Basasula.
Basasula, Yeah.
You should be focused on YouTube. Serious money.
I know you. I want to learn from you.
Kale katuberekereze musibe bulungi mwera.
And for women out there, happy Women's Day.
Yes. Dr. Abade tabagaliza Women's Day. Twakyogedde. Happy Women's Day, Dr. Njagalize. Olyoka obaagalize, please. Yes. So congratulations, happy Women's Day.
Happy Women's Day, Zubedah.
Yes, thank you, Doctor.
Women are really amazing. They are strong. They are determined. We know that without women, this world would be in chaos. So you guys do so much. But also as doctors who specialize in women treatment, we are really humbled by the opportunity to be able to work with you in these different journeys and to treat. So we are happy and we pray that you guys stay amazing.
Oh, that is good. So andange musibe bulungi mweraba.
Executive Media. Focus, innovate, succeed.